We are inherently asymmetrical. We're meant to be asymmetrical. And some asymmetry is normal, but excessive asymmetry is problematic.
And I guess what I hear in that more than anything is like hope that like even if things were happening, whether in utero or in infancy, that there are still solutions to be found in terms of chronic pain relief and proper gait and breathing and all that.
If you look in Africa, in cultures don't have westernized philosophies, they have huge jaws. Their jaws are forwardly grown, their airways are big, they're not having sleep apnea. And so why do we in westernized cultures? And it's all about lifestyle.
There's a certain level of malaise or discomfort that I've come to just grow accustomed to. And I'm like, this can't be the norm.
I do think healing in general is like this journey. Like, people come to see me and I just feel like I'm a piece of the puzzle, and it depends on how far along that healing journey you want to go.
Hello and welcome to another episode of the Embracing Human podcast. I am your host, Scott Stone, and I'm here with a very special guest today, Aleena Kanner. She is a postural restoration provider as well as a certified athletic trainer. Aleena, welcome to the show.
Thank you so much for having me. I'm so excited.
Yeah, it's good to see you. It's been quite a while since we met in Cream Coffee in Arizona. Maybe that's where we start. So we're sitting in Cream Coffee. I've got my conversation starter, my dog, and you've got yours. Tell us about Elvie the Pelvy.
Oh my God. So he's right behind me. It's just a big pelvis model that is a mobile pelvis model. And I usually will clip him to my backpack to take him with me to the airport. Now, at that time, I was studying to get certified in what you mentioned, postural restoration. And it's really hard for me to like visualize. So in order for me to understand the material, I literally took this pelvis with me everywhere as I was studying. So you were like, what is that?
Yes,
Like, why do you have a pelvis?
Why do you have a pelvis? Tell me more. Tell us what postural restoration is and how you got into it.
Yeah, so it's an institute that I study from. The main focus of our institute is looking at asymmetry, looking at facial asymmetry, body asymmetry, and really why that's there and what to do about it. Because we are inherently asymmetrical. We're meant to be asymmetrical. And some asymmetry is normal, but excessive asymmetry is problematic. So it's really, I say asymmetry, but in reality, asymmetry is the study of the brain. So we're looking at the brain hemispheres and essentially what is going on when you see somebody who's super asymmetrical. And we bypass the system by using respiration and sensory tools. So for me and what I do and what I really enjoy doing is the dental and the vision appointments and really learning about dentistry and optometry because these sensory tools are so profound for the system. And so I'm using that along with respiration and just different things when we're doing these respiratory techniques that are different than other types of techniques, and we'll get into it, to elicit a long-term change into someone's body, not short-term. We want this to stick around, and we're essentially bypassing the system and getting deeper into the nervous system.
Mm-hmm. The quote that hits me when you speak on that is short-term gratification is just long-term suffering. Or delayed gratification is something like that. I don't remember what exactly it is. But like, tell me a little bit about this, like the long-term results and working with the body in order to provide not short-term fixes, but actually lasting change.
Yeah, so most people that I'm seeing have tried a lot of things. They've tried chiropractic care, they've tried physical therapy, they've tried personal training, they've tried like lifting their way through their injury, they've gone to doctors, and they're still not getting better. And there's a reason why some people get better faster than others. And typically, there's a lot of reasons as to why that might happen. But the people that are coming to see me, all these things that may have helped person A and it's not helping person B, the person B maybe has different layers of issues that need to be addressed. And for person B, we might really need to look at asymmetry, whereas person A can go 3 PT appointments and they feel better. That's great. Maybe something happened in the PT that worked for them. Maybe they don't have any trauma. Maybe they don't have any, emotional baggage. Maybe they've never had a car accident, head injury. Maybe they've never had braces or anything that could impede their sensory system. But person B typically has other things going on that many providers are not trained to look at. So I'm trained at this point now to look at vision, to look at dentistry, to look, of course, at how somebody breathes, and to look at their whole sensory system, to look at their asymmetries and see what's going on. So it's very rare at this point that I'm getting somebody who has a very clean history. And if they do, they're coming to me because they're like, oh, well, I just want to do a checkup. I feel great. But when I see people in a lot of pain, there's reason for it. So I want to give a long-term solution. And that long-term solution, we have to look at all the levels of why they're in pain and really address all that. So whether it's a dental component or vision, when I know the root cause, then I'm actually able to make a long-term change. So.
Well, I guess I'm like your bread and butter then, because I've done a lot of different things, right? Like I've done therapy, I've done physical therapy, I've done functional patterns, I've done a lot of different things and a lot of different tools and practices and whatnot to get out of this chronic pain that I find myself in. I could say it's like a habitually tight psoas or like a really tight, glute medius or something, but I ultimately have no idea why I'm still in chronic pain. And, therapy's done a lot to deal with it, but I feel like the compensation strategies of my body are now so hard coded that I don't know why my left foot splays out a little bit and, like just certain things. And I'm curious if you could just kind of walk us through if there's like, and I know you mentioned the dental and the vision and all that stuff of like how you, I don't know if I want to use the word diagnose, but just kind of, understand a system that is presented to you.
Yeah, the way that I do my assessments, now this is just me, is that I'm looking at that person's history and I'm getting a lot out of that history. I'm of course doing a movement assessment, but I spend a lot of time in that person's history. So when I hear like a chronic pain in the left hip or chronic back pain, I want to go really far back in the history to figure out why.
Hmm.
And I want to know when it started and all these things. But I'm also looking at dental history and optometry history, vision history. And knowing that about somebody can really give me some insight to what their issue is. Typically, people with a clean history are not going to have like a chronic pain situation that doesn't go away. There's usually things in that person's history. Like I said, it could be dental, it could be vision, head injuries, ankle injuries, like rolling ankles that can actually contribute a lot to the cranium. But yeah, we'll see, certain athletes that do certain sports for long extended periods of time. And then they have layers of compensation on top. But there are things that I am looking for that are red flags. There are things that are yellow flags. So, like you mentioned before, braces. Like to me, most people get braces. Most bodies are able to handle that. Braces, age 13, 14, 15, that's a yellow flag. To me, it tells me about someone's development, but we also talked about teeth, premolars getting pulled. That's a red flag to me. So there are certain things that I'm looking at when I'm asking these questions to figure out why is this person stuck? Why has nothing else helped this person?
Yeah. Tell me a little bit about how teeth play into this, developmental framework and what the teeth are doing in terms of, head, not necessarily head positioning, but like cranial development and all that.
Yeah, sure. So first, if we're talking about teeth, we have to also talk about the tongue and airway
I have a
positionings.
tongue tie as well.
Me too. I do too. And
Okay, good.
so
I'm
I'm
not I'm
not
not alone here.
surprised. A lot of people do. If you have the MTHFR gene mutation, a lot of times those people have tongue ties, and it's becoming more and more seen in today's society because I think that gene mutation is increased because we're just toxic around us. But yeah, when I think dentistry, I am thinking about development of baby, child. So I am going back. I'm asking, how were you born? If someone's coming here, they're sitting and I'm assessing them. How were you born? Were you C-section? Were you pulled out with a vacuum? That tells me a little bit about just cranial development at that young baby newborn age. I'm asking if they were breastfed. I'm asking, did they crawl? We need to be able to crawl and do all these, essentially integrate our primitive reflexes to have proper development. And if primitive reflexes aren't integrated at the ages they should be, we're going to see development problems, developmental delays. We're going to see, issues, even things like I was with a friend today and she is very similar to me in her mindset and she's really baby wearing. So she's wearing her baby all the time. That gives the baby more access to their airway versus putting them in a stroller. So she's walking around 2 hours today the baby hates a stroller, so she didn't even use the stroller. She used it to carry her things. And to me, it's very interesting because the more you do that, the more child has better facial development. Tongue ties is a big thing. Little babies can have ties. Now, typically, if there's no feeding issue, they're not cut. And that's okay. It depends on the person whether they need to be cut at that young age, and it depends on the therapy and the person doing the therapy. Myofunctional therapy is my favorite thing for that. But there are reasons as to why children develop these really small palates that need braces or getting teeth pulled. That's what they used to do. In some places they're still doing that. And or expanders. When I hear that a 13-year-old had to get braces, I'm thinking, what was their development like? So it really goes really back to childhood, to infancy, what happened there. And it can even go back even further into the in utero, right? When you have a mother that's taking a lot of folic acid, you can get folic acid in bread and you eating that, and folic acid is going to contribute to that child's MTHFR gene mutation maybe popping off and then them having webbing in their mouth. So now the child is born with this MTHFR gene mutation. They're going to have tongue ties, and now their tongue cannot get up to the roof of the mouth. So the only way that that mouth grows properly, meaning it has to grow, both jaws have to come forward and laterally. And how that happens is tongue position, like resting tongue position, needs to be on the roof of the mouth. You have a baby that's tongue tied, that tongue's not getting there. So they might use their thumb or their fingers, which is going to create oral motor like dysfunction. And then you also need to use the tongue for proper swallow. So if they're using the tongue to thrust forward instead of swallow properly, we're also going to see problems with the development of the oral cavity. So it really goes back to embryo if we want to understand what is happening with my 18-year-old patient that has braces for their second time.
Hmm.
Yeah.
Wow. Yeah, it's incredible to see like how far back you can go to trace these things. And I guess what I hear in that more than anything is like hope that like even if things were happening, whether in utero or in infancy, that there are still solutions to be found in terms of chronic pain relief and proper gait and breathing and all
Yeah.
that.
Yeah. Yeah, I mean, breastfeeding is obviously an amazing palate expander. The position of the tongue is the palate expander. But even like you have an 8-year-old who their tongue ties are now impeding them, we're seeing that the development's not ideal. They can do treatment for it. You can go to myofunctional therapy. You can release the tongue ties and you can work on it. But it has to be done in conjunction with body work because you can't just
Hmm.
chop the head off from the rest of the system. So even, looking at a baby that was pulled out with a vacuum, that baby needs body work, or
Hmm.
C-section baby. They didn't use the spinal galant reflex to get out of the womb. So they're going to need body work. Like all of these things, there's solutions and there's definitely hope because we know more now than we've ever knew before. So
Mm. Yeah. So you mentioned, things like oral cavity, expansion and development and tongue placement and all that. How does that later then contribute to respiration habits and what people are going to see later in life?
yeah, you're gonna definitely see it pop up if especially we're seeing it now with like this boomer generation and even millennials that all had the wrong orthodontic treatment. So back, I don't know the exact years, but when I think his name was Engel took over the orthodontic field. I do have a video on it, so I can send it to you because you can link it, but I can't remember the specific ortho. But they did have something called retractive orthodontia, and that's what you went through. That's what I went through. That's what most people went through, boomers, millennials. And now we're looking at expansive orthodontia. So a lot of these kids, one of the things we can do is expand them to give them the ability to have a better airway. But what happened in our generations, which is really your question, like, where does this lead to? So, kid with a tongue tie, let's just take one kid. Let's say they're born, they have MTHFR gene, they're born with a tongue tie. They weren't breastfed, so tongue tie was never caught. They grew up, they were fine. They did, made it through school, whatnot. They might have had some struggles with ADHD or, struggles focusing. And then they played sports, they were active, but as they got older, maybe they stopped being as active. And they got their premolars pulled because their mouth was small, because they didn't breastfeed. They didn't chew really hard foods to grow the palate, and their tongue never got up to the roof of their mouth. So they became a bit of a mouth breather while playing sports in middle school. And the mouth breathing has contributed to an elongated face and the need that their teeth were so crooked that the dentist said, let's pull your premolars so that we can make room in your mouth for your tongue. What we typically see a patient like this later on down the line, this is a person that's going to have airway problems, sleep apnea, maybe need a CPAP. They're going to be really struggling, even in their 20s and 30s, to just breathe because those, when you take teeth out of a cranium, that's the support for the cranium. And those teeth really are there for a reason, or else we wouldn't be born with them. We don't need to make the mouth small. What happens is they take the teeth out, the mouth gets smaller. So yeah, we might be straightening the teeth when we do that because now the teeth all fit in the mouth. But we're actually just making the mouth smaller, which makes the airway smaller. And then we're going to have like the back of the throat's going to collapse. So we're going to have all these airway problems. What could have been done is proper breastfeeding, which is going to elicit a response to the mom. Hey, this baby's not latching properly. Maybe we need to go get an evaluation by a lactation consultant and maybe they'll catch a tongue tie. Then you release that tongue tie, you get the right body work done, you get the right myofunctional therapy done. Now the baby can breastfeed. Now we're going to have better palatal expansion. Let's say they didn't get as much palatal expansion as necessary by the time they're 8 years old, which is around, what we're seeing now with expansive orthodontia. So what I first described is retractive ortho, where we put braces on and it retracts everything in and it makes it smaller. That was like how we've typically done orthodontic care, and honestly how today it's still mostly being done. But now with the airway dentists, what we're seeing is more of a care for other things. So back to our kid who, had the tongue ties released, they now are able to breastfeed and they're growing up. They're not mouth breathing because the tongue ties were released at a young age. And their tongue is at the roof of their mouth. Maybe they're not amazing at it, but they are getting some crooked teeth. But today, in today's society, what we're typically going to see is a kid's going to get expansion. We can start with devices from like kids doing it at a very young age, like even 2-year-olds. Like I can see it in a 2-year-old's face if they're going to need expansion, just because they should have a certain amount of teeth you see. They should. But if they don't, then they're probably setting themselves up for long-term problems. These expansion devices for women and men, it's a bit different because cranial bones for men fuse a little bit more strong. They're stronger because of muscle mass on men and testosterone. And so men, they really need to do it before 18 years old, maybe even earlier, 16, some dentists would say. But you can move the cranial bones. So they'll put a device in. There's tons of different types of devices, whether it's a minimal device or more maximal, more invasive, surgically assisted expander or a non-surgically assisted. But we're going to see that the cranium is going to grow. And if you do that along with body work, we're going to see amazing results. It just has to be done with the right body work. And in my opinion, when it comes to adults, I use postural restoration. When it comes to children, we work on the primitive reflexes. So that's kind of like the summary of retractive ortho and what that looks like in a child, and then expansive ortho and what that looks like. And we're going to see that because those kids are able to keep all their teeth, they're going to have way better health outcomes. And also, that expansion is really how our skulls are meant to be made. If you look in Africa, in cultures don't have westernized philosophies, they have huge jaws. Their jaws are forwardly grown. They have so much space. Their airways are big. They're not having sleep apnea. They don't need to sleep with a sleep apnea CPAP device. They don't have this problem. Mm-hmm. So why do we in westernized cultures? And it's all about lifestyle. It's literally what it comes down to. Mm-hmm. And of course, issues that I think our culture has put on us, dentists have put on us, doctors have put on us, that we don't realize are these westernized philosophies that we think might be helpful, but in reality, it's just masking the symptom.
There's so much there. Like, I think about, I don't remember where I saw it, but like this whole like avocado toast and smoothie culture that we live in where we don't chew our foods anymore.
Yeah.
And therefore just poor jaw health and all the things that go
Yeah.
pacifiers and all
Yeah.
the things, like you said, lifestyle that contribute to this dysfunctional way of being that we see so prevalent and create entire industries around that other cultures are like, they don't have any prevalence of this at all.
Yeah. Yeah. It's so interesting because today I was literally hanging out with my friend who I mentioned is very similar to me, and she's like a functional optometrist, and so she had her baby and we were just talking about like how her baby is eating chicken and she usually chews it up and then gives it to her baby like a bird does. But the baby should be eating things like fats and protein. And that's another thing, nutrition in childhood is really important, especially
Mm-hmm.
those like first year of life when the brain is rapidly growing in that first 3 months. We need to be putting good food into them. I mean, maybe they're not eating at 3 months yet, obviously, but right. So there's a reason that I think nature has put things in the right order. We're supposed to be breastfeeding, we're supposed to be doing all these things now. Of course, not everybody can do that, but there are other methods and things that can still help, and there's hope out there for as a child gets older and has certain problems come up. As long as you know what to look for, you should be able to mitigate it with a proper solution.
Yeah. No, and you mentioned earlier about, including things like myofunctional therapy and body work in things like tongue tie releases. I
Yeah.
started going down that route, and that was one of the most like hammered in things I heard was like, look, you can do this and any dentist is going to do it for you and they'll bill you for it happily. But like, if you do not have proper myofunctional therapy pre and post work body work, like you could
Yeah.
put yourself into an anxiety coma.
Yeah. Yeah. So I treat those patients that have done their second release or first release and it's completely wrecked their nervous system. And so I'm tied. I have a grade 3 tongue tie. I have a lip tie. I have buccal ties. I'm tied everywhere. I have not done that yet. It is on my mind to do my lip because it does bother me, and maybe one day I'll do my tongue. But in reality, I was tied and I didn't get the right expansion. So if I just laser my tongue and cut my tongue, where's my tongue going to go? Is it going to fall to the back of my throat? So when you go and you just get these done by the dentist, they will happily do it. You're right. But we need to make sure that the tongue is supported, the body is supported. The tongue is like, how I explain the tongue is like you have a map. So you have different layers of maps, and then you have one line in between all those maps to orient the maps. Okay. That one line that goes through is your tongue tie. So that is that frenulum. That is your ability to understand stability in space. When you cut that, you're taking away everything from somebody.
Mm.
So depends on the person's starting point and nervous system. I've seen people have like 6 to 8 week long recoveries because they were in a horrible place when they decided to go get that done.
Mm-hmm.
Versus some people are like, it was fine. I didn't notice the difference. Your body notices the difference regardless. Maybe it makes you feel better, maybe it makes you feel worse, but your nervous system feels it because that is stabilization for you, and you just cut that away. So in my 30s, am I going to immediately cut that? No, I'm going to be really careful. A
Mm-hmm.
lip tie is not nearly as neurologically there's no the play in with the nervous system with the lip tie is not as much, which is why I'm not as nervous to do it. But tongue tie for me, really like I'd have to really be convinced to do it at this point because I have seen it go negatively. So it can go great, but we need to be doing the right body work. And when it comes to like the specifics of postural restoration, even if you do myofunctional therapy and only myo, you might be fine. But if you are in a nervous system that is stressed out and you struggle most of the time, I'd say 70% of the time, you should not go get your tongue released. You need to seek out a PRI provider to work on asymmetry first.
Hmm.
So, yeah.
Yeah, I mean, it's been on my, I don't know if I would be so strong as to call it my to-do list, but you've been in the back of my mind ever since I met you. There is a certain level of malaise or discomfort that I've come to just grow accustomed to, and I'm like, this can't be the norm. And granted, I had a really traumatic childhood, and I was breastfed, and I like 50-50 your list,
Yeah.
and yet like and granted, years of therapy helped a lot with addictive tendencies and whatnot, but there is still
Yeah.
some level of like it's just weird feeling in this body sometimes, and so
Yeah.
it's an interesting playground to live inside of.
And I think, trauma does play a really big role, like really big. It's something that I don't even understand or grasp. I don't think most therapists grasp because I think that talk therapy really only brushes on the surface. You have to do like subconscious work to get it out and moving and let things go. But that is a big thing. But also, yeah, the body keeps the score, the body remembers. I don't think people have to stay in chronic pain. I don't. I think when things are addressed properly, they can change. But I also feel like healing for me, because I don't really struggle with pain, but I've struggled with other things. Like I'm super sensitive. If I take a supplement that my body doesn't like, I have a Herx reaction like that. So I have other things. My genetics are really fragile. It's the best way to put it. But I do think healing in general is like this journey. Like people come to see me and I just feel like I'm a piece of the puzzle. Like, and it depends on how far along that healing journey you want to go. You're somebody like me, like you really want to feel good. Like some
Yeah,
people would just like be okay, like 30% better. Some people are going to be okay, 50% better. Me and you are kind of like on this lifelong path to like always better ourselves. Like, even though I'm pain free, when I don't sleep, I do have some back pain. Pain doesn't really affect me. To me, my not sleeping affects me more than anything else.
totally.
So that I'm always just trying to get things better and be on this like healing journey. And I just feel like sometimes I'll have patients come in and they're like, oh, I've spent all this money already and like I'm not better. And they say that after seeing other providers and then coming to see me, like I'm coming to you as this is my last option. And it's like, okay, I'll try my best to like get you as good as you can feel, but there also might be more. Like you might have underlying trauma that you never dealt with besides talk therapy that needs to be uncovered. Like you
Hmm.
might not feel better if you don't meditate. Like there's a lot of things we can be doing, but I think when it comes to like actual body pain, like I really do think people can get better. I see it all the time.
Hmm.
Can I promise that every single person can get better? No, because I've also seen body pain really be deeply emotional en
Hmm.
route. But
Yep.
my thing is, I look at the emotional stuff, but I also am looking at the physical stuff. So I have to ask those questions. Did you have premolars pulled? Like, that's a red flag. We talked about it. To me, that's a really important piece of the puzzle for someone. They could be doing all the emotional work in the world and really, feeling bad about themselves that that's not getting it out. But maybe it's that structural situation that actually is
Hmm.
impeding them. It could be.
Yeah. No, that's a really good point, and to what you said earlier, like being on this journey, it's interesting. As I sit here right now, I have no pain,
Mm,
but I've been in like such a pain state and like rooted in the pain body for so long, my brain almost doesn't know how to calm down. It's
right.
like looking for that pain for some level of certainty to be like, no, like that's there though, right? Because that's like almost the new baby blanket.
Yeah. Yeah, I understand that. I can relate to that. And I've seen that too. It's like the brain like remembers that, and that's the most recent sensation. So what PRI's goal is to give you new sensations to take away from
Mm,
that pain, and the more positive experiences you have, the
hmm.
better.
Yeah.
Then you're overriding it, which is possible.
Yeah.
But not everybody can do it with just breathing techniques. Like our main thing, how we treat people is what we call like positional breathing. Because you're
Yep.
not just laying on your back and breathing, although I do love like tons of different breath work. I love
Sure.
holotropic breathing. I've done a bunch of different stuff. I really do like that. But our exercises, we are breathing in through the nose, out through the mouth, specifically
Hmm.
out through the mouth because we want to stimulate the obliques to pull the ribs down. That
Hmm.
is like a big thing that other people that do myofunctional therapy and people that do breath work don't understand why we breathe out through the mouth. Because I promote nasal breathing all the time, but I also need you to breathe out through your mouth when you're doing these techniques because I'm trying to elicit a muscular change, which is going to elicit a nervous system change.
Hmm.
So having you breathe all the way out, get your obliques on, pull the rib cage down. Now I can breathe air into areas that are more compressed. So our positional breathing techniques are in very funky positions, like you wouldn't expect. But when you understand how the walking cycle is, the gait cycle, then those positions that we do in our breath work really do make sense. So even if I do breathing techniques with somebody after a couple sessions, they're not getting better. That's when I'm like, okay, maybe they're making some changes. Usually people always make changes. It's pretty rare. It does happen where somebody comes in and nothing changes them. That's usually an emotional blockage. But usually they'll make some changes, and maybe by the third session they're like, "Ah, it's still hurting me. It's better. It's 25% better, but it's still there." Then I'm looking like, okay, what do you have going on vision wise? What do you have going on dental wise? Do we need to go deep and address these?
Hmm.
Yeah.
Yeah, no, that makes sense. And I love what you said there about positional breathing. And most breathwork practitioners do not understand it. It's just belly,
Yeah.
maybe into the chest. But like, people who don't understand rib flare and positional breathing and chambered breathing and understanding how these ribs and lungs really work, it can be deeply
Yeah.
dysregulating as a practice, and that doesn't integrate. Like I tell people, you can't just go Wim Hof your way through your day. Like
Yeah.
your nerve
No.
system's gonna fry.
Right. I like Wim Hof at the top of a mountain when I'm done hiking, but like, yeah, there's like breath work you can do to drive sympathetics, and there's breath work you can do to drive parasympathetics. And pretty
Right.
much what we're trying to do here is parasympathetic work. That's what I'm
Right.
just trying to regulate people's nervous systems because
Yeah.
we're all upregulated anyway with modern society, unfortunately.
Yeah. Yeah. I make the joke that like Wim Hof will change your day, but Buteyko will change your life.
Buteyko is interesting. I've done a little bit, but not enough to like be
Hmm.
able to, talk about it. But PRI is very different from all of them because we are doing these breaths with the intention to be in certain compressed positions so
Hmm.
that we can breathe into areas that are naturally compressed. So, for
Hmm.
example, because this is the only way that this is going to make sense, our diaphragm on the right side is bigger than the diaphragm on the left side. It
Hmm.
attaches lower onto the lumbar spine compared to the diaphragm on the left. And we also have three lobes of lung on the right side of our body and only two on the left. And we have a liver that's on average 3 pounds on the right side of the body. Our heart is asymmetrical. We have all these asymmetries, but we are inherently heavier on the right side of our body. So, what
Hmm.
we see with people is that their body weight will shift more over to the right and will compress down into that right chest wall. And we'll see that this, because the heart on the left side, we'll see that the left rib cage will flare upwards ever so slightly.
Hmm.
Not everyone's going to look like that. Some people are going to have a bilateral rib flare where both ribs are lifted up. Some people are going to have it opposite. But underlying, that is the asymmetry, and that is what's going on underneath it all for every human, unless they have their organs flipped, which is rare, but it does happen. So, because of that, I know that most people have more compression on that right side. That right chest wall is more compressed. So, I can do different tests to get more information from the person. How well do they breathe up into their upper third chamber of their lungs up here? Because a lot of breath work doesn't talk about that, it only talks about belly breathing.
Hmm.
And in my opinion, belly breathing actually just pushes us more forward in space. So we have this asymmetry underlying this body. So, how do we make a change? So, a lot of the techniques will have that when you breathe out, will have a slight crunch to the left so that you can blow all your air out and feel your left obliques. Because once you get the tension in your left obliques, you can easily breathe into that right chest wall. If I
Hmm.
just have you lay on your back, you're going to go wherever the breath wants to go. I don't want the breath to do that. I want to dictate where your breath goes. And so, in order for me to do that, I have to bias you into a position, have you hold and breathe there, and really have you blow all your air out. Pause for 3 seconds, get that parasympathetic going, and then you're going to be able to like inflate like a balloon into whatever wherever I want it to go.
Hmm.
Most people also just need air in both sides of their chest, and most people also need air in their back. I don't see many people that need air in their belly.
Right.
Like nobody. Because
Right.
our ribs are so extended, most of us on both sides, many people, we're naturally breathing into our belly all the time. Babies, people are always like, well, babies breathe like that. Okay, babies also have a triple the size head than you do. They're meant to breathe like that. It's like as they get older, it has to change a little bit. Now, we should have some air moving into our belly, but it shouldn't be the prime mechanism. We have to be able to get air into all the other areas.
Hmm.
So, and one of my favorite things is the back lung area, like in the
Hmm.
middle of the back, right where those shoulder blades are.
Hmm.
That's where the posterior mediastinum lies, and the vagus nerve on both sides goes right through there. So if you can get air back there, usually we'll do it in like an all four position, have them round, or we'll kind of do different ones where their arms are reaching forward on both sides and really stay rounded without this happening. I don't want the neck doing the breath. I want the
Mm-hmm.
chest filling up with the breath without the neck working. So if you can get air back there into that upper back, people will be like falling asleep after
Mm-hmm.
because I'm really stimulating their parasympathetic nervous system.
Mm-hmm.
So, yeah.
Yeah, I love that. And I had a breathwork session recently, which was like that. It was like, okay, don't move your belly, just breathe into your back mid ribs. And I was just like, what? Like, okay, now just breathe into your, just like these very positional and very challenging things that I don't think most people could do. I could barely do it. And I'm pretty good with my lung positioning, I would say. Like,
Yeah. I feel like if I biased you, you could do it because
yeah,
you have so much capacity to breathe and you've done so much work. I feel like you'd get it quick. It's like people that have never done breath work that you're trying to teach this really complicated exercise to. I'm like, oh my God.
yeah,
But
zero proprioception awareness, all that.
oh my goodness. Or if they have like a visual problem that went unaddressed their entire life. Like I have one patient I'm thinking of, and I can't even get her into it. All four position, like knees under hips, wrists under arms, and round her back. She doesn't know how to do that.
Hmm.
That's how off her visual system is. So I can't even help her until we do optometry first.
Wow.
So it's so interesting. But most people are not like that.
Yeah.
That is also a background of sedentary lifestyle,
Hmm.
due to how she grew up, not really a choice. You know, like kids that do gymnastics and taekwondo, they're going to have more mobility and movement to be able to do stuff.
Right.
Uh, but yeah, I think for you, like you'd be able to get it way easier than most other people. It's
Okay.
just about biasing the position.
Yeah. Yeah.
And it's about the cueing too.
Yeah.
Like,
And that I think I learned a lot in functional patterns of like very compromised position and breathe into this thing. And yeah, that's its own like thing of that type of training. But
yeah.
I'm curious where you'd rather take this. You talked about visual cueing, but I think the other place that is really hot to talk these days is foot, is barefoot life and
Yeah.
foot, shoe choice and all that.
Yeah, I love that topic. I did a little lecture for my community today about feet and shoes, but mainly about feet and tibial movement and just like what is going on there. Yeah, so a lot of people come in, they're like, I'm in this minimalist shoe. So I feel like I'm doing the right thing. And I'm like, oh, you got bought out by the marketing because you literally live in Manhattan. You know, I am all about the frequency exchange that we get with the ground when we go out grounding barefoot. I'm actually going to go out to the beach tonight and go walk on the beach barefoot because it just helps so much. You feel so much better. That is great. I'm walking on an uneven surface. The sand comes up to my foot, it hugs my foot, it meets my arch, it cups my heel, and it's hard to move through sand and dirt and grass and desert land and marshland and all these different types of earth that we have around us. We are meant to be barefoot 100%. So that's never the argument. People come at me, they're like, we're meant to be barefoot and that's not what you talk about. I think we're meant to be barefoot. I just don't think we live in a modern we live I don't think we live in a society that we used to live in when we were cavemen. We live in a modern society. So we have to change our life to adapt to that modern society. When I'm walking around in my apartment, I'm walking on hardwood floors. That is not the same as walking outside in the sand. It's just not. The bones in my foot have to figure out how to now heel strike, pronate, resupinate, push off. Well, first we actually heel strike, then supinate, then pronate, and then push off. I just kind of said all the terms that we do. My foot's not going to be able to do that on a hardwood floor. Even the best compensators probably won't be able to do something like that. Maybe some athletes will. But unless we're in a shoe that gives our brain sensation. So the shoes that I really push people towards are Brooks and Asics, sometimes Hoka's, but not really. And it sounds crazy because I'm like a very holistic person. Why would we wear such a bulky shoe? But it's not about that. I'm looking at the shoe from a standpoint of what is the shoe offering my brain that's on my foot? Because my brain needs to understand groundedness. When we're not walking on uneven surfaces like sand or grass, we need to bring that up to the foot. So I tell a lot of my patients, it is not about the foot. The shoe is not for the foot. The shoe is for the brain. Because the shoe, there's all these, oh, you're wearing foot coffins. And it's like, I agree with that. I think our feet should be free. But that's not, when I'm going to work in Manhattan, I'm not walking there barefoot. And I'm not going to be barefoot in Manhattan. That's literally dangerous. If I want to lose a foot, I'll do that. Um, but we need that ability to move through that full range of motion. I actually have a foot here because of the lecture. So we have to heel strike. The heel has to hit, and it's not supposed to like be wobbly and go all over the place. It has to hit in a way that helps the talus bone, this bone here, orient the rest of the body. So if we're in a place where our foot's collapsed, that talus bone is going to be collapsed. If we have a super high arch, that talus bone is going to be lifted up. So we need a heel counter, the same way the sand cups the back of a foot. We need a heel counter to help position the talus so that the midfoot can pronate, which means flatten, and then the big toe can push off and you can propel your body forward. As soon as that doesn't happen, we lock up. We'll lock up in the neck. So a lot of times I put shoes on people and their neck gets free like that. And it's crazy how much I see that. So I like Brooks and Asics. I have like an ebook for free on my website. I always offer it for free. Every 6 months, it comes out a new one with all the new shoes. I update it. I put it on my website. I want to offer that for free always because it should be free for people to get in the right shoe. All the shoes on the list are great. There are categories for like high arch, low arch. You don't have to go by them, in my opinion. Some other providers would say different. I noticed that if you take a couple pairs of shoes and you try them on at the store, you're going to know which one feels good. And if you don't, and you have a provider to test you, then you can figure it out. But I'll know which shoe I feel good in. So, and my patients do too. I will test people because I can test their body and see which one is best for them. But for the most part, if people just go to a store and try on a good shoe, they're going to notice a difference. And, that just means that they should be in that shoe, especially if they're in chronic pain, really as much as possible while we're doing techniques and while we're getting their body in a better position. But a lot of times people feel so much better in those shoes that they don't want to stop wearing them. And that's what happened to me. Like, I wore minimal shoes. I remember I was in London in 2018. I was an Olympic weightlifter. I was in London. I was traveling and I went to Vivo barefoot and I bought all these barefoot shoes, like two or three of them. And I had so much heel pain. And I was just like, it's fine. My body's just adapting. No, I'm just walking literally barefoot with no padding on London concrete jungle floors. And a couple years later, I ended up trying out the Brooks and I was like, I don't feel any different. I don't feel any different. And as I actually untwisted my cranium, that's when I noticed if I don't wear my Brooks shoe, it's kind of like a clean diet, but if I don't wear my Brooks shoe, my body will feel it the next day. If I wear I can wear Birkenstocks and I can wear Brooks, but I'm not gonna, if I wore Birkenstocks like all day, I think my body would feel it. But it's like a clean diet. Like I've cleaned my diet up. If I go and eat like crap, my body's really gonna feel it. But one of my best friends eats like crap all the time and she's fine. But if she cleaned her diet up, her body would recognize that what she's mainly eating is crap. So my feet appreciate I'm always grounded and I'm always able to move through the full range on both sides. So when I'm not, now I have a punishment, I guess. But yeah, that's my thought on feet, shoes, and flat surfaces versus uneven surfaces.
Yeah. Yeah, I was curious if it makes more sense to get someone to be barefoot on the uneven surfaces like the nature and the beaches and all that stuff, or to get them into the proper shoe. And I might have kind of just thought of the proper answer is that most people don't have access. Like if you live in New York, you don't have access to
Yeah.
that
Not
type
easy
of
access.
playground. Right.
Like I'm fortunate that I live by the beach, but still it's not like easy access. Like I still have to like leave and go outside and take my shoes off. It's like not such an easy thing versus like just going outdoors and having grass in your backyard. But I do it and I feel better when I do. But I definitely think that to deal with modern society, we need a shoe that supports us.
Yeah. Yeah. Like in my case, like I can literally walk outside and I live on 4 acres. I can go run barefoot through the yard with my dog and then I can go to the beach. Like I feel very blessed in that, like what I'll call atypical solution. But, I also go to the supermarket and I go to the coffee shop and all that type of stuff.
Yeah,
stuff. And this is just ego, I guess, because I'm like, God, I want like a good looking shoe that
I know.
cups my heel, and it's just not that common.
No, it's hard to find. And I mean, Brooks and Asics, like I get $0 from them.
Right.
Nothing. I don't get anything to promote them, and I haven't found anything better, or else I would promote. But yeah, they don't really care that I'm just a little person out here educating and promoting their stuff. But yeah, I do. I really think they make a good shoe. Brooks has been around since like for a very long time. But I do. I believe in their company. I don't think all of their shoes are good. I think some of their shoes are good. I think some of them are really not great, but I think the majority of Brooks and Asics shoes are really good. So that's why I like create that list so people can check it out.
Mm. It's definitely something to consider for me because they're uh, and Hawaii literally, like, there ain't no shoes, no service, no shoot, no service signs. Like, you can walk into the supermarket barefoot
Yeah.
and shirtless, no problem. Any supermarket, Whole Foods, Foodland, local shop, and
Yeah, I mean,
not
and
that
most
common.
people are going to be fine walking barefoot around an island like that because it's such a relaxed island. But, we've talked before, you've told me some of your history. I think when people have a more difficult history, they're going to have a harder time with their groundedness on the floor. So if
Hmm.
let's say you were to start wearing shoes, you might not necessarily notice it immediately, but you might notice it over time that you've
Hmm.
just are in less pain.
It's very possible, especially on long distances. Like, if I go on a long
Yeah.
hike, my knee by the end of mile 4 is just like, bro, what are you doing to me? Like, why?
Yeah.
What did I do to deserve this?
Right.
I'm like, I don't know, bro. What are you doing? Like, what's wrong?
Yeah. And it's one knee only.
Yep.
So then to me, that's already why is it one knee? And, I already automatically go into my asymmetry mind of like,
Right.
which knee is it? Because it's different if it's right versus left.
Right. I think
So,
it's my left knee. My right hip is what's tight. My left knee is what starts to hurt. Both of my feet are flat as a board, you know.
and some of that can be genetic. Flat feet can be genetic, but it can get worse, with time as the
Yeah.
arch is kind of trying to come down. But I mean, I'm not going to say you could change flat feet because you can't. You can make changes to your feet, but I don't really care so much about changing your feet. I care how your brain senses the ground.
Hmm.
So the fact though that I see, like you're telling me you have super flat feet, I know a shoe will help you. It's going to
Yeah.
change how your brain feels that floor. But you
Interesting.
can still be barefoot outside whenever you're going outside. I just think when you're
Right.
inside, when you're doing those, supermarket runs, things like that, like get in a good shoe and you'll probably notice it. Your
Right.
body might notice it.
Yeah. Yeah, we'll have to find an indoor solution because wearing shoes in houses is like super frowned upon in Hawaii.
Yeah, I'm
Like
sure.
like the Asian culture just runs thick here. It's like
Yeah.
don't you dare.
I have a lot of Asian patients and Indian patients, and it's like completely frowned upon. And my patients that are in the most pain, they get a pair for indoors, or they'll get the like
Right,
things that go
right.
around the foot, like
Yeah,
because I don't need it 24/7. I need it for like 2 to 3 months while I'm working on the body.
yeah,
And then the thing is, people typically feel better.
yeah.
Some people come in, they're like, I can't be barefoot ever. I'm in so much pain.
Wow.
Yeah.
Interesting. That might be my dad. My dad like literally can't walk barefoot.
Yeah, it's funny because I can now, but I was like that for a little bit. And I was a gymnast, so I was barefoot all the time.
Yeah.
And gymnastics is really great. Besides that, it does produce a lot of hypermobility. Gymnastics is great for kids getting rid of their reflexes, and some of that is about getting their feet integrated with the ground, doing different things with their feet,
Interesting.
crawling, moving their feet on like a bar and things like that.
Yeah, I remember seeing one of your posts about crawling and just like the
Yeah.
the the aspects of a lot of things that we just don't think about. I
I
mean, maybe
know.
maybe I don't have kids, so why would I think about it? But if I did, like, that's just still not a thing that I think is random,
You know, I don't have kids either, but all my friends had babies last year, and I got fascinated. And so now I've been studying human development because it's like, well, I really work with adults, but why are they here in the first place? It's
Hmm.
just interesting. I can't necessarily go back in time and fix them, but it does tell me more about their story.
Hmm. Tell me a little bit about vision, and like I guess we'll talk LASIK specifically. I've worn glasses since high school. I have a very stable prescription. In fact, it's gotten better over time. And for that, I've had this idea of like, oh, let's look at LASIK. And like I said earlier, I looked at some of your content, and I'm like, I'm definitely not getting LASIK. Like it's
Yeah,
just the idea of some of the horror stories I've witnessed from your content and
got
people
it.
sharing their experiences is like, no thanks.
LASIK is a horror story, in my opinion. I'm very loudly against LASIK. I wish I could say that the surgery is not the problem, but the surgery is the problem, but also the fact that there's a lot of reasons. So, starting off with the structural reason, they are whether they're doing LASIK or PRK, they're either shaving the cornea or cutting like a hole in the cornea, and then they're changing that shape. But the eyeball, when it has a prescription to not be able to see far distance, the eyeball, instead of it being sphere, it's elongated. So you're never changing that. So the eyeball in the eye is still elongated. So when they actually do LASIK, there's 10 times more risk of retinal detachment. Retinal detachment can be cause blindness. So that is a very interesting statistic. Most people, after getting LASIK, they never go back to the eye doctor. They're like, oh, I'm good. No, you actually need to go back more because you had LASIK. I hate to I don't want to scare people because a lot of people have already done LASIK. So it's okay if you've had it. You're probably okay if you're seeing this and you have done LASIK, you're probably okay. But I will tell you, they're my more difficult patients. And that's because, like I mentioned, we're very asymmetrical. Our cranium is also asymmetrical. We have cranial bones on one side doing something different on the other side. We have a sphenoid bone that might be in a position where it's up on one side and down on the other. We have a jaw, all these different movements that occur in the cranium and in the body. LASIK, when LASIK is done, what I see is I cannot, no matter how many techniques I do, that body won't shift out of those cranial positions and out of the body positions. So we typically have to go back to an optometrist and we have to give them a new prescription. We might have to get a dental appliance in their mouth and then go to an optometrist. But typically, a lot of times with LASIK, it is the wrong prescription. It's either overcorrected or just completely wrong compared to what they actually need. A lot of times the reasons it's not just LASIK is overcorrected, a lot of prescriptions are overcorrected. A lot of times that happens because when an optometrist is working with you, they have you in a dark room with the lights off. They have you looking through a machine, looking at a focal point, and you have no peripheral vision. And so that's going to tone your system up and for you to, they're asking you to see what's sharper, A or B, one or two, whatever. So they're asking in that context of the situation for your sympathetics to go up and for you to find that perfect pitch perfect letter. But they're going to say, okay, you've had this prescription for a few years, we can do LASIK. And every year your prescription's gone up, but maybe that starting point of that prescription was wrong because maybe if we corrected you in a place of natural lighting, and maybe if we corrected you standing and not sitting, and maybe if we corrected you with trial frames instead of in a phoropter, or we did a combination, like my optometrist will use a phoropter on me to get my prescription, but then we'll stand me up and we do more prescription checks. And that's what I do with my patients. But we also always check it standing because from sitting to standing, it can make a big change because
Mm.
we are not meant to check our eyes seated. We don't use our visual system. We do use it seated, but we also really use it standing. We use it walking and moving through space. So LASIK, people that are getting LASIK done, they've never had that intense of an eye exam to know what their prescription is. So that's why it can be overcorrected or the wrong prescription. So yeah, LASIK, those patients usually are way more complicated.
Hmm.
Yeah.
Well, guess I'm wearing glasses.
Yeah. Contacts are fine. I mean, I like total daily ones because you can still get UV lighting. That's another thing.
Mm-hmm.
When they do LASIK to your cornea, it changes how the brain can sense light from the sun.
Mm.
We need that light from the sun for circadian balance. So there's a lot of reasons why LASIK is detrimental. I'm just not a fan.
Yeah, that's a really interesting point. Actually, I regretted buying these glasses with the UV protectant coating because I'm like,
Yeah.
I wish I could undo that without having to buy new lenses. Because
So you can just get CR39 lenses and they're cheaper than they're the cheapest type of lens So you can literally go to the store and switch out your lenses and get CR39. I don't wear glasses anymore, but I did for 15 years and I still have a prescription. I just, especially in the summer, I opt not to wear it.
Right.
It's such a light prescription. It's more astigmatism than anything else, but very asymmetrical. One eye is up close, one eye is for far away. So confusing for the brain. You can wear total daily ones. I was actually allergic to a lot of the contact brands besides total daily ones, which is interesting because total daily ones, which is a maroon box, those allow for UV light to permeate, whereas all the other contacts don't. And those are just a higher quality contact. They're also more expensive. So I always bought more expensive contacts because the other ones would pop out of my eyes. I'd get very itchy. So I got lucky because I guess I've been having UV light for 15 years, circadian rhythm balancing. But yeah, you can change out the lenses. I would recommend so that you can get UV light in your eyes,
Yeah.
you
Yeah.
know. But yeah,
So
that's the deal about LASIK.
right, yeah, no, I appreciate the perspective on it, and it definitely helped me see that, like, and like I said, my prescription's low, and I don't mind wearing contacts, and it's not the end of the world. I actually like glasses. It's like a fashion accessory, so it's not a big deal. But it is interesting to see how much of, you know, the medical world is based on like style.
I
It's
know.
like
Well,
this
it's things
looks
they can
better,
sell you.
right?
It's things they
Right,
can sell you, you
right.
know?
I'm curious what so, you've been in the world of wellness for a long time, both as a practitioner as well as a provider. What do you see as some of the things that are sold that are just absolute trash and some of the things that are not
Oh my
talked
God.
about that are really good?
Okay. I have so many. First off, posture trainers. I hate them. They're horrible
What's
because
a
they're just,
posture
they
trainer?
like attach to you and pull
Oh,
your
okay. Oh, yeah, yeah,
back.
yeah, yeah,
Hate
yeah.
that. Um, Another thing I hate is the mouth tape industry.
Mm,
I think most mouth tapes are made like crap, and you can just use really basic like scar tape or like I
literally.
do like one I found like Dream IO. I don't have any affiliates for any of this. I do think mouth tape is a very underrated thing that we should be doing way more of. This isn't like a big thing, but there's like these all these jaw things right now where you just go and chew this really intensive gum. I have a
Yep.
problem with it because like for example, my TMJs don't align well. If I chew that gum, I'll be in pain for 2 days. You
Mm,
can't just do that. You need to have proper jaw position. Now, if I was expanded as a child and my TMJs fit great, yeah, it'd be awesome. It would shape my jaw cool, but that's not my situation. So you need to know your situation. I don't
mhm.
like lumbar supports in cars. Those are not good. We don't need anything pushing us forward or any ergonomic chair where it's pushing you forward. I don't like that. Underrated thing for like work environment is put your feet up on a stool. Like going to
Mm,
the bathroom toilet, you should have that little seat
body
there.
potty?
Yes, that is a great thing. I'm all for that. There's a lot of things in the field of like chiro and physical therapy. It's like all this expensive technology. I just don't think it's all necessary. I think some things are necessary. I'm about to invest in something that's a piece of technology, but I don't think most are necessary. I think
Mhm.
that we can heal with the breath, we can heal with the sensory system. CPAP machines, I'm not a fan of unless it's absolutely necessary. I think they're really problematic and dangerous. Trying to think like what else I see. Invisalign can be problematic and dangerous, although Invisalign could also be great. Just depends on the timing and with who it's happening. Orthotics, foot orthotics. I have a problem with the way that most foot orthotics are made because they're really hard and rigid, and the foot is meant to have mobility and movement and stability. But I do like the foot orthotics we make and some that are like certain brands. Invisalign can be good, just depends on the timing, and depends on the person, it depends on what's going on with their nervous system. But for the most part, most dentists are not viewing the person as a whole.
Mhm.
So it's kind of difficult. And then the other thing I was going to say is orthotics. Most orthotics that I see are very hard and rigid. Those are very problematic.
Oh,
Take those out.
I had a
Horrible.
pair of orthotics given me when I was like 15. They were the most uncomfortable things I've ever put on my foot.
Yeah. Your brain also hated them because you're
Yeah,
super flat foot. You don't need to be fixed. That's not the problem.
yeah.
You need a little bit of an arch support, but it has to be something that your body can press into. It should be really flexible and moldable. Yeah, I'm not a fan of those orthotics. Oh, heel lifts. People put heel lifts in a shoe. Absolutely not. Address the asymmetry. There's an
Mm,
asymmetry up the chain that you're noticing. It's really rare that somebody has a real leg length discrepancy. But
interesting.
yeah, those are the kind of things I'm thinking.
That's such an interesting one, and I don't know what this is, but like, Once a year, I'll wake up and one leg will be significantly longer to the point where I'm like lopsided walking.
Yeah, that's an asymmetry at the pelvis and the rib cage.
Okay.
You can change it though. You know what
Yeah.
else? This is kind of crazy, but I don't sleep with a pillow. People are always like, what? I don't sleep with a pillow at all. I trained myself in 2020, I'd say, 2020, 2021, to just like start with a blanket and then go to nothing. Babies don't sleep with pillows.
Are you a
Why do we
back
need
sleeper or a
pillows?
side sleeper?
Side sleeper.
Interesting.
Mm-hmm. I don't
I
need a
wish
pillow.
I could sleep on my back, but I don't think my nervous system can handle it.
I don't like, I can't sleep on my back. But yeah, why do I need a pillow? Cavemen didn't use pillows. Maybe they used leaves, but it was flat. So a lot of my colleagues are like, "You're nuts," but I really don't think we're meant to use pillows. And when I asked Ron, who created the institute, he was like, "We're not meant for pillows." I was like, "Okay, I'll take it," because a lot of these people that need so many pillows, we're just pushing the airway and we're just tightening it down, so it's necessary. Yeah, no, I sleep on my side and I don't use a pillow,
Wow.
pretty
I'm so
much.
inspired.
Oh, underrated. I think craniosacral therapy can be really powerful for children.
Hmm. Yeah.
Yeah. Yeah, I'm
I've got
also
a
primitive reflexes, all that stuff.
yeah, I've got a short list and I mentioned it to you before the show started of just myth or magic,
Yeah.
different things in the industry and your take on them. First off, red light.
I like my red light. I haven't used it as much, and then today I used it. I give it like 7 out of 10.
Okay.
Cold exposure.
Cold exposure.
So I like it. I think it depends on the person system and their hormones if they can handle it. Yeah, I'd say like 7.5, 7. I like that.
Okay. PEMF.
I think it depends on which PEMF device. I have one. I'm not a huge fan. I like the heat that comes out of it. But like a beamer device, which is like more expensive, I think it's like an 8.
Okay. Hyperbaric oxygen.
Actually, wait, I take it back because the amp coil, I'll take it. It's like that's like a 9 for me, 9.5.
Yeah. I mean,
Hy-
I've seen some really nice ones, like, the $100,000
those are
PEMF
like,
machines
yeah. The one I
that
have
I'm
is
like,
like crappy, but like I
yeah,
really do like a beamer and I really do like the amp coil. So if we're talking about that type of PMF, I'm like 9.5.
okay, got it.
Um,
Hyperbaric oxygen.
I've done it a few times. I didn't feel such a difference. I felt cranial pressure.
Hmm.
Oh, it's really good for you. I'd say 8.
Fasting.
Okay, I like can't do that, but I think it's amazing for you if your nervous system can handle it. I don't think like a woman going through perimenopause or struggling should really do something like that. I'd say 8.
You don't think a woman going through perimenopausal and then it froze?
Yeah, I think that women struggling need to be careful.
Okay.
And then I said 8
Yeah.
for fasting.
Last two, raw milk.
Okay, I really like it. I like my raw A2 chocolate milk, but sometimes it'll hurt my stomach.
Okay.
So I think it's like a 7, 7.
Okay. I could just see Elise being like, no.
Oh, she's obsessed. Obsessed. Actually, the raw milk, chocolate milk in my freezer is hers.
I guess I would say one last question for those who are interested, where can they get a hold of you? Where can they see your content, all that type of stuff?
Yeah, I'm on Instagram, Aleena Kanner. I'm everywhere with just that handle. So
And
have
we'll link that in the bio too.
yeah, my website. And I see patients in New York City and also Long Island. But I think I'm going to be traveling for 4 months this year, and the location is not fully known yet. And I will see patients on the road.
Okay, great. Well, I have a whole slew of questions for another time about digital nomading and living abroad and traveling, which is how we met. Both of us were in that world, so another time.
Well, yeah, we'll have to do that conversation.
Yeah, that's a whole nother that's for the entrepreneurial listeners and not the chronic pain listeners. But
Yeah,
yeah, no, I really appreciate the time, Alina, and it's always wonderful to witness you and your craft and your
thank you.
content. Your content game like baffles my mind because it is so specific and so incredibly like wrought with knowledge, and your engagement is like wild.
I know, actually, people have told me that my engagement's insane. It's
It
true.
is.
I get 1.6 million views like every week. And I
Yeah.
feel like that's That's like, to me, that's like normal. I thought everybody with the following that I had hit that, but apparently no. So thank you to the people helping me do that. I do it because I enjoy it. Like, I really, really enjoy getting this information out to people. It is hard because I want to help everybody on the other end, and that's not always possible. Well,
Yeah.
thank you for having me.
Yeah. No, it's great
I
to see you.
It was so fun. Thank you
Yeah.
so much. It was a great conversation.
Yeah. And I'm gonna have to jump into your scheduling tool at some point and get
Yeah.
on. I have a massage table sitting right in front of me, so we can do it from afar.
No, I should just come to Hawaii.
That is, you are welcome to come visit whenever you want.
God. I might take you up on that.
This is one of the most incredible places I have ever witnessed in my entire life.
I want to go.
And the beaches are like pristine, and I live in the rainforest. Like,
Oh my God.
yeah,
That's amazing.
there are so many incredible barefoot hikes we can go on. You just let me know when you're ready.
Okay.
Yeah.
All right. Maybe that will be part of my undisclosed location
Right. Yeah.
for Fox.
I'm sure
Maybe
you
that'll
can
come for a week or two.
swoop up some clients here or on
Oh,
Oahu or
totally.
yeah.
That'd be great. All right. We'll keep the conversation open. We'll
Yes.
film in person next time.
There we go. Awesome.
Sweet.
Well, thank you, Aleena, for being part of the show and sharing your wisdom with all of us.
Thank you
It's a
so much for
pleasure.
having me.
Yes. And thank you to the audience. Thank you for giving us your time and attention. And until the next episode, aloha.